Okay, so we have here a cross section of the low back. This is a patient low back MRI. You can see a couple things here, right? You can see this is the spinous process in the middle. We've got the lamina going out this way. This is all bone. And we've got the facet joint over here, this other facet joint over there. And as you can see, the disc itself is very deep. Now this yellow thing right there and this yellow thing right there, that's the nerve root. So we can't really hit that. We can't inject into that. If we do, we might paralyze the patient. So there's only really one way to get into this disc, and that would be under X-ray guidance. You put one needle here, and then you thread a second flexible needle in through there, and you can get into the disc. But you've got to stay away from that nerve. And it looks something like that. Now, as you can see, the nerve's sitting right there, and we can't hit the nerve. So it's pretty difficult to get past that nerve and safely get into the disc. Again, if you hit the nerve, if you were to slice through the nerve, you can paralyze the patient. That's why disc injections are a big deal. Another reason they're a big deal is they can cause discitis or an infection in the disc, about 1 in 300 times, somewhere in that neighborhood. So fluoroscopy allows the doctor to see through that bone, and contrast, like here and here and here, allows the doctor to know that they are in the disc. To answer the questions like, will the cells go into the disc? Will they leak out of the disc? Will they end up in a certain part of the disc and not another part of the disc? You can't do that without X-ray guidance and contrast. Now, will ultrasound work? We've got a big problem with ultrasound. If I put the ultrasound probe here, ultrasound works by bouncing sound and then receiving sound. Well, the bone's in the way. I can't see the disc. I can't see down here with ultrasound. And that's the big problem. You might be able to angle the probe over here and maybe see just a little slice of a little window, but you could never ever see where the stuff was going to go. So ultrasound is just not the way to do this. It's really not standard of care, and it's almost impossible to accurately inject a disc under ultrasound because there's bone in the way. So if someone tells you they're going to inject a disc under ultrasound, that's fiction. Blind is totally ridiculous, right? There's a small little window here in which to get the needle that's only about 1 centimeter wide, and the likelihood that you're going to find that centimeter window that's buried 3 inches deep in the patient is slim and none, and Slim's on vacation in Texas, meaning you're never going to find that blind. It's just not going to happen. And you'll probably end up paralyzing the patient. So if the clinic lied about placing cells into your disc and tried to tell you that this could be done blind or with ultrasound, what else are they lying about? That's the question you need to ask. Thanks so much for watching, and have a great day.